weight gain, joint pain, anxiety, fatigue, brain fog. If you are a middle-aged woman, this may sound familiar to you, but please do not allow your physician to tell you that it's just depression or perimenopause. Hi, my name is Laura Casey, and I am a Hashimoto autoimmune thyroid patient and also a patient educator. I suffered many of these symptoms and more. As I progressively got ill, I went doctor to doctor trying to find answers until I finally found one that decided to think outside of the box and do thyroid testing, which showed that I had Hashimoto's autoimmune thyroid disease, which had caused me to become hypothyroid. Now, after listening to my speech today, I hope that you will become your own advocate and ask for testing to be done when you go for your annual exams each year. And if you are a woman and over the age of 30, this is even more important for you and your family members as well. Now, today I want to show you that Hashimoto's is a major problem in middle-aged women. It is increasing, and we have to find a solution to this problem. First of all, you need to understand that Hashimoto's is an autoimmune disease, and it affects your system and causes an array of issues. Now, according to the Women's Health publication, untreated Hashimoto's can be very, very serious, and it can lead to infertility, miscarriage, high cholesterol, seizures, coma, and unfortunately even death. It is that serious. Now, the Mayo Clinic also states that Hashimoto's has become more prevalent in middle age and older women as well. Now, myself personally, I know 13 family and friend members just from my small little country town that have Hashimoto's, and they developed it in middle age. Now, I would like to explain briefly what Hashimoto's is. It is an autoimmune disease in which your body actually develops antibodies that attack and destroy your thyroid gland. Now, your thyroid gland is responsible for your cardiovascular system, your respiratory system, your hormones, your metabolism. So as this disease progresses and destroys the thyroid gland, you will become more hypothyroid. Some of the simple symptoms, and as they progress, develop into fatigue, weight gain, joint, muscle pain, menstrual cycle irregularities, depression, anxiety, heart palpitations, your hair can fall out, enlarged thyroid gland, and many, many more. Now, the major reason for the increase in this disease is that the thyroid tests are not being done. Now, the American Thyroid Association says that there is no universal recommendations for testing, but they recommend that every woman start being tested at age 35 and every 5 years thereafter. Now, they also suggest that these are the three most important tests: the TSH, the free T4, and the free T3. Now, most physicians will only run a TSH. It is very important that you also have these other two, since the TSH is only a pituitary function test. It only shows just a small part of what's going on. So I ask you, take the time to please write these three tests down, because without the three, you cannot get the whole picture. The frees are your actual active thyroid hormone in your body. Without the conversion and the most active form of free T3, your heart cannot function properly, you cannot breathe properly, your metabolism can't work, and your hormones are going to be affected. Now, if any tests show abnormal, then you run the antibody testing. Now, first, before we jump to the antibody testing, I would suggest that every woman, when she goes for her annual visit with her OBGYN, that you write down these tests and ask her or him to run these tests with your annuals. They're more apt to be open and listening and running these tests because they're in the hormone business. And all of your hormones work together. Now, if anything does show abnormal, then I would ask for a referral to an endocrinologist who will then run the American Thyroid Association's recommendations of the thyroid peroxidase antibody test and the thyroglobulin antibody test. It's important that you ask for both of those to be run because a thyroid patient like myself will test positive for one and not for the other. Now, according to my doctor, I have an endocrinologist, Dr. Pardo. He says the reason why testing usually is not done properly is because in medical school, they're just taught very briefly the very, very basics of thyroid testing and thyroid disease. This is something that they really have to learn more on their own, even as an endocrinologist. Now, unfortunately, he also states that in his experience and his years of practice, he is seeing an increase in middle-aged women coming to him with Hashimoto's. They're undertreated, untreated, and they're just so very, very ill. When I found him, I was extremely ill. Now, the good news is, especially if you catch Hashimoto's in enough time, it's a simple treatment. And the treatment is as simple as taking a daily thyroid replacement hormone pill. Now, hopefully, you understand that the issue and the problem here is thyroid testing not being done. And hopefully today, I have convinced you that Hashimoto's is an increasing problem in middle-aged women. And the solution to this would be to encourage more thyroid testing to be done with annual labs. If this was done, middle-aged women wouldn't needlessly get sick from this horrendous disease. And we discussed how serious this can be. Now, today in conclusion, I ask you to be the solution and to be your own advocate and ask to be tested.